It's a systematic review. Quite a few authors. It's a newer article as well, from 2022. Just want to preface by saying some of the pronunciation of words might not be my best. I'm in speech therapy to try to work on that, but just FYI, I'm sure you'll get what I'm saying. But for the sake of my embarrassment, I just wanted to preface by saying that. So we're starting with key findings. Preliminary evidence of efficacy. The 12 studies included in the review suggest that animal-assisted therapy, AAT, may be beneficial as an adjunctive treatment for eating disorders. Psychological outcomes reported include there was a reduction in eating disorder symptoms, particularly around body image dissatisfaction and emotional eating. Oof, I only use that emotional eating verbiage because of the article, but don't really care for that. There were marked improvements in self-esteem, emotion regulation, and treatment and motivation for treatment. Also enhanced therapeutic alliance and client engagement, especially in resistant or ambivalent clients, and within the eating disorder population is a large chunk of clients that are both resistant and ambivalent. So that was encouraging to read. Predominant use of equine assisted therapy. The majority of interventions involved horses, while a few used dogs. That was interesting for me to read. Um, Interactions included grooming, groundwork, and relationship building with the animal. Equine assisted therapy was frequently used for experiential learning, helping clients practice boundary setting, assertiveness, and emotion in identifying emotions. However, there were a lack of standardized intervention protocols. No two studies used the same structure or duration. That was a huge red flag for me. Intervention durations range from a single session to weekly programs over several months. Some incorporated animals within CBT or psychodynamic therapy, while others use EGALA or non-specified experiential frameworks. And of course, this leads to this next bullet point. This heterogeneity limits comparability and replicability. Another bullet point that frustrates me is population studied. Participants were primarily female, 88%, and mostly adolescents or young adults, reflecting the demographics of eating disorder diagnoses. This was another interesting bullet point too. Diagnoses included anorexia nervosa, bulimia nervosa, and binge eating disorder, though some studies grouped diagnoses together without differentiation. Which, I don't know, that's confusing to me just because of the symptom presentation and in each of the diagnoses. I know that, eating disorders are kind of all deeply rooted in restriction and control and trauma and all of the things. However, it would be interesting to like hone in on each diagnosis with the intervention and learning more about if the symptomology within that diagnosis was reduced. Mixed methodologies. Methodological designs included case studies, pre-post studies without control groups, and another interesting thing that I read was there was only one RCT that was found. Again, most studies use small sample sizes, which included under 30 participants, which clearly would limit statistical power and generalizability. Qualitative components revealed that participants found AAT more engaging, less stigmatizing, and this was interesting for me to read too, emotionally safer than traditional talk therapy, which I'd be interested to learn more about that solely because I think of lived experience and I think of inviting friends that have never seen my 17-hand horse before, and they come to the barn and they're like, Amanda, how are you like actually going to get on this horse or like stand next to it? So like that was just interesting for me to read because I would think that sitting across from somebody in a therapy room would feel more, would feel emotionally safer than, being next to a gigantor horse. But it was interesting. I don't know. Strengths of the article. Relevance. This is the first known systematic review focused specifically on animal-assisted therapy in the treatment of eating disorders, which from the research that I did for the research paper and for the research paper presentation, this is a huge area of, there's a lot of clinical interest with AAT, which, highlights the increasing integration of experiential therapies into mental health care. There's a comprehensive lit search. Authors followed PRISMA guidelines, ensuring the transparency and reproducibility, which was important. Holistic inclusion of studies included both qual and quantitative studies, which obviously would allow for richer insight into client experiences and treatment outcomes. I really liked also how they honed in on the emphasis for future research needs. Clearly identifies key research gaps, lack of RCTs, underdefined theoretical models, and calls for standardization of AAT protocols. Thank you. Yes, thank you, thank you, thank you. I feel like there needs to be, protocols so that we can actually confirm the validity of said protocol. Like, I don't know. I could go on and on. I think that I will in my actual presentation on the bigger presentation on Tuesday. Potential clinical implications. Offer support for AAT as a promising adjunct to traditional ED treatments, especially for improving emotion regulation and engagement in therapy. Moving on to limitations and critiques. Heterogeneity of studies. Interventions varied widely by species. Again, oof, I thought it was about horses. Horses, dogs. The duration of treatment, and the theoretical orientation, which made it difficult to compare outcomes or draw generalized conclusions. Lack of theoretical frameworks. Many studies did not articulate how AAT was expected to affect ED symptoms, limiting interpretability and reproducibility, which I think I spoke to a little bit on another slide. It would be interesting to learn a little bit more about the reduction in eating disorder symptoms. There's a limited use of experimental designs. There are very few RCTs. Again, most were observational or case-based, which would in turn reduce the strength of causal claims. There were small sample sizes and demographic homogeneity. Most studies featured fewer than 30 participants, and again, I think that's like my word. Focused primarily on white female adolescents, limiting, obviously, which would limit the generalizability. There is a risk of publication bias. Studies with positive outcomes were more likely to be published, skewing the perceived effectiveness of AAT. And finally, ethical and practical concerns not fully explored. While AAT is appealing, few studies discussed animal welfare or clinician training, which are important for ethical implementation. And I think, what I've learned about EGALA, that's the exception. And moving to discussion questions. What mechanisms might explain the therapeutic benefits of AAT and ED treatment? How can future research improve the methodological quality of studies on AAT? I really like this next question. Should AAT be considered a primary or adjunctive therapy for eating disorders, and why? I'd love to have a discussion about that. I know the class is ending on Tuesday, but it's just interesting. And what ethical considerations arise when incorporating animals into mental health treatment? I feel like that final question we've spoken to a little bit this semester, and I think that there could still be more fruitful discussions about it. Finally, my references. If you have any questions or clarifying questions, feel free to reach out. Thanks.